As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, let's camera action, I'm ready to go. I'm never gonna give up.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everyone. It's a great morning for me. I'm in a mood where, and moods do change, but I think it's fair, even if you feel somber or depressed or out of sorts, to still claim the moment. Each day is a blessing in some ways, and each day is a present. It's the constant present, but it also is a gift. It's a gift to you. I'm sure as you listen to this show, there are people that you know that are no longer around. And, life is not guaranteed for everyone, forever, I should say. So let's just seize the moment. Let's just seize the moment of commitment and dedication and perseverance and being alive and sharing and loving one another. I say all these things because it's really on my heart to have just shared as I talk this morning for the next 45, 50 minutes with Maritza Bond. And Maritza is the New Haven Department of Public Health Director. And her job and public health directors nationwide, we were talking about this off air, are responsible for are partially responsible for our health, our safety, and our pursuit of happiness. All of us are as civic participants and citizens of the state have a role to play for our safety and our sobriety and our furtherance of being an integrated person in terms of our body, mind, and spirit. But health department people nationwide, there's an issue. You can contrast public health with private health, but when it comes to public health, these folks have a great responsibility. And lastly, leadership is not a popularity contest. So Maritza, we're going to chat a little bit about her current responsibilities, about COVID, about vaccinations, about safety, and what's involved here. I was talking to my wife, Maritza, yesterday, and I said that some people are going to tune out this show. They don't want to hear it. They've given up. They have given up. They don't even know that young people 5+ ages are eligible for vaccinations. I was talking to a good friend this morning who's really, he's on my high esteem in terms of content and news. And he thought it was still just 12 and nothing below 12 in terms of vaccinations, which surprised me, but just drove home the point that there's a lot of information that we need to share. There's been the recent court decision this past week about masks, although other states and cities are having a different take on it. So let's just dive in terms of COVID. The reason for the show today, not that we need a reason, because at any time in the existence of the planet, public health is a primary concern. But on Friday, April 22nd, 2020, it's 2021 and 2022. What year is this?
2022.
So 2022. We could go with the Israeli calendar or the Aztec calendar. So time is relative, right? But time is certainly relative. But let's jump right in terms of today's show about. I'll use the word crisis. You can dial me down a little bit if I get too overly dramatic in terms of what you had to say, but this is still a crisis. We have something called COVID-19. I mean, just listen to that, folks. COVID-19, this is now 2022, and we're still talking about something that occurred in 2019. So Maritza, tell us about, there's been some reports of an increase in cases for COVID. So elaborate a little bit about that.
Yeah, absolutely.
Please.
Well, thank you for having me again. It's always a pleasure to be back. I know over the last 2 years, we've had a number of different department officials come on the show and provide updates. And it is, a great pleasure to be here this morning with you as well. One of the things that we do as the health department in leading the response to COVID is making sure that people have access to information and access to resources. And we've been successful in doing that through partnership. And part of the job in responding to COVID, we also do a lot of surveillance and monitoring of where our case rates are and also how we're doing with our vaccination rates. And right now, we were anticipating that we were going to see a slight surge, which means an increase in cases. And we certainly have been seeing that. Right now, we are in the last 2 weeks, the last week, we had over 200 cases. We're averaging about 40 cases a day. And that is a 10% increase from last week. So we're starting to steadily see an increase again. Most of the cases that are being reported currently are Omicron BA2, which is a secondary strain from Omicron. I like to call it Omicron's cousin. And we are starting to see individuals reporting those cases and seeing them increase. And so for us, we are making sure that we're monitoring the PCR reported cases. But what's important to know is that the cases also are not being reported if you're taking a rapid home test or rapid antigen test at a clinic. That is not being reported to us in our data system. So we rely on a couple of other surveillance metrics. We're looking at our hospitalization and the capacity to make sure that as we see the cases rise, where are we with capacity for being able to treat COVID patients? And right now, we also seen hospitalizations increase. For our New Haven County area, we have 36 patients who are currently hospitalized. That's a 56% increase from our previous week. And our test positivity rate in the city is at 4.6, which is also a significant increase from just last week. And so it's important that we also monitor sewage data. Sewage data has allowed us to be able to get a better indicator of where we are and how we're doing as a city. And so for me, right now, my goal is to just inform the public so that they know how we're doing as a community and be able to socially be responsible on the mask optional in public places so that they can protect themselves and other family members.
And we're going to talk about, protection and prevention in a second, but I just want to drill down a little further on the current situation in terms of people that might be afflicted and people that might not even know they are afflicted until they get tested. But before I go there, Moritz, I just want to repeat the point about leadership is not a popularity contest. For example, this is springtime, it's April. Folks are looking forward in May, June, and July to the beaches, but something might happen this summer that you might have to close a beach. And the reason I want you to elaborate on this point is there's private health issues, but that's sometimes separate from public health. So I may feel that I'm strong enough to swim in a bacteria-infested beach, but that's a private decision that I really am not going to have the option to make because it impacts the public in terms of beaches and bacteria. So just to remind people, just a small example about, it's not that you are a sheriff, but you are a loving protector.
Yeah, our job is to promote, prevent, and protect the public well-being. And I oversee 7 departments. And within government executive management, you have to make those tough decisions to making sure that you're monitoring also, for example, our public beaches. Our public beaches are an oversight of and responsibility for the city of New Haven. And as the health official, we test the waters at least twice a week during the summer months so that we can make sure that the bacteria levels are within the range that it needs to be so that people can be swimming and enjoying the water. Because trust me, I'm a beach body. I love the beach. And I myself frequent the beach in the summer months, but it's important for us to ensure that it's safe for us to do it. I also license businesses across the city. And so thousands of businesses I license, and it's important for us also make sure that businesses are in compliance with certain safety measures and regulations. And so my job, although I am a regulator, our goal is to really provide education and prevention so that people can be protected overall.
Again, we're going to elaborate on protection and prevention shortly, but share with folks a little bit, because you hear this term long COVID.
Oh, yes.
And even if everybody was 3,000% healthy today, folks that have been afflicted might still, there's a lot of literature that folks are still could still have symptoms down the road.
But there's recent publications, and one of the things that we do as health officials are responsible to looking at the science and how it continues to evolve. I mean, we have come so far in the last 2 years. However, what we're seeing of those that have been impacted by COVID, the long-term side effects. I have seen it with my own family members. My son had COVID and has still is 6 months later, and he still doesn't have taste buds. And so the long-term side effects is what we have to be mindful of because it could be detrimental to our internal organs. And people even have long COVID brain fog, and it is now proven both in adults and children. And so oftentimes we hear the public saying, well, I'd rather get COVID instead of getting vaccinated. And that is not the right thing to say because you don't have knowledge of the long-term effects that it can have on you or your child. Unfortunately, in the city of New Haven, we have one of the lowest vaccination rates among children. And we're working on a campaign right now, and that's why I'm on the radio, is to urge parents to really protect their children because although it's mild, they are also now being impacted with long-term side effects, especially in our city when asthma rates is so prominent. We want to make sure that our children are not affected long-term with their ability to be able to breathe normally as they would, or be able to have longer impact with their asthma because of the long COVID that they've had.
We did a show actually on Monday, Maritza, on asthma. So there's so many interlocking related issues for folks to understand about the fragility of the body and how you have to really manage your total body system and your health, not just from your eyes, your ears, your nose, your throat, your chest, your knees, but everything is connected. So you gotta be aware and be proactive. When you mentioned your son, and thanks for sharing that in terms of transparency. This show is not designed to scare people. I don't want to scare people, but I do feel just pressured, not pressured, but I feel that we must get this information out, and hopefully people will act accordingly in spite of their putting their heads in the sand.
Yeah, absolutely. And I think it's so critical and vital. I mean, in the midst of responding to a pandemic myself, there was my mom, my grandmother, there were so many of my family members personally being impacted. And that's why I'm a strong advocate for, getting vaccinated and getting treatment as early as possible so that people can be able to get through it, especially those of us that have extended family members that may have medical conditions or even ourselves. It's really important to protect ourselves. We are now have the second booster that's eligible for people. And so we want to make sure that people get that second booster because what we do know is that although we have been able to evolve, we do see that the vaccine wanes over time. And we want to make sure that people, especially people with medical conditions, get that second booster so that they can remain protected.
What are some of the, just when you mentioned that about the second booster, what are some of the stats in terms of the percentage of young people at the ages 5 that have had the first dose and maybe the second dose, and how many have had the
Yeah. So
booster?
right now for the first dose overall as a city, first dose age 5 and over, we're at 80%, 80.9%. And then second dose of age 5 and plus, we're at 70%. But for booster doses, we're only at 34.8%. And if we break the data even further for youth, we're not even at anywhere near 50% when we're looking at specific adolescent groups. So it's really critical and vital that we continue to provide the information, create awareness through interviews such as this one so that people can have the knowledge and the autonomy to make those right choices, especially when we know that we're going to hit a peak, really encouraging people to know what, when they're gathering in large settings, to just think through whether or not they need to wear a mask. Because as you know, we lifted that requirement with the exception of public schools and city buildings. But it's important for people to just be conscious of their surroundings and monitoring how the city is doing as a whole in regards to COVID-19 cases.
So, I mean, just when you mentioned the taking collective action. Talk and the peaking or the seasonality. I mean, we have the proms coming up, we have graduations coming up, we have little league events coming up, people coming outside, picnics, family reunion. Talk about that a little bit again, because I'm not here to scare people, but I guess feel we gotta ring the alarm constantly.
Yeah, and I get it. Masking up for the last 2 years and the restrictions that were, put on community. Listen, I was dealing with those constrictions myself. As health officials, we are having to comply with the same restrictions, and it's all about just being socially responsible. And as we're organizing events, and I work very closely with the Board of Ed, they have been amazing partners to ensure that when they're organizing school trips or overnight trips, that mitigation strategies are in place. What we know for a fact is that utilizing masks played a major role in being able to reduce the number of cases and even flu cases. I mean, we wore a mask and we did not really see flu cases in 2021 because of in 2020 because of the mitigation strategies that we had in place. So it's really crucial that we continue to remember that hand washing works. And so, washing your hands often, social distancing when you're in gatherings, and outdoor gatherings are still preferred. And so as we're gearing up for spring events and summer events, let's gather together for sure, but making sure that we are being socially responsible if we ourselves are healthy, but we may go into a room where others are not healthy, wearing a mask can protect that individual.
And we're going to talk more about protection and prevention, but I wanted to go back a little bit in terms of the long COVID, because someone has even mentioned to me that you may feel that you don't have it, you can feel that you've recovered and then have a relapse.
Mhm.
Is that consistent with your understanding?
Yeah, so I mean, what we know is that a number of people have, gotten COVID multiple times, and
Hmm.
it is unfortunate. And so, what we do know is that Omicron did impact many communities, but the symptoms were milder. And right now, what's being reported, even with the Omicron BA.2, is that it is mild cases. And but people still deal with the long COVID of fatigue and shortness of breath, cognitive dysfunction, and generally the impact of just everyday function. I mean, people are, just express how they're not able to sort of kick it out of their system because it takes longer. So depending on how our body responds
Mhm.
to to COVID-19 and testing positive, it is all individualized, and that's why it's important to also consult with your provider and making sure that you're working closely with your provider to to the treatment that you may be able to get so that you be able to deal with those side effects as quickly as possible.
I was looking at this morning just in terms of the COVID vaccination clinics and the availability really in various places. I mean, on the New Haven Green.
Yeah.
So just share us a little bit about that.
Listen, one of the things that we did in this pandemic is that we were really big about access and equity and making sure that we are in the community and not forcing people to come to us.
Mm.
Government management is not about being a top down approach, it's about also serving as a convener. And we've partnered with a number of entities at the local level to making sure that vaccines are accessible in all communities. And so we are offering vaccines 7 days a week and are proud of the work that we have done. And as you can see, the city of New Haven have high vaccination rates as a whole. We just have to now ensure that our youth are getting vaccinated and that the second boosters are getting administered to those people that really need it.
And so are you giving like $1,000 for if I get, if I'm in, I
We don't
need
have
my
any
second,
incentives.
I need my second booster. I'm young at heart, but I'm at that age where I got to get everything that I can get. Uh, you referenced earlier in terms of even beach closings, there's some discussion about looking at wastewater as being indicative of, I guess, bacteria count. So talk to me a little bit about that. Where I'm going with this is, if at some point, and again, I'm not trying to put you on the spot, and your answer might have to be legitimately speculative, but if we can look at bacteria count terms of determining whether we should close a beach, are we trending toward that stage where we look at our I forget the government, our agency that determines when we go to the bathroom, but there's that mechanism where we can determine if COVID is on the increase. Are we looking at the point where that will be an indicator of further
Yeah.
enhanced
That's
enforcement?
one of the major metrics that we're using as an indicator because it's reliable. You believe it or not, you can actually have an indicator of a number of infectious diseases. It's an amazing surveillance system that can allow us to have data live and be able to have interventions in place earlier. And so I am a strong proponent of the sewage surveillance system. Right now we were working with Yale University, and now CDC expanded that further, and our sewage systems are also reporting to the CDC because it's really critical for us to be able to say, okay, are we seeing an increase? And we're able to project at least 5 days out. And so it gives us the ability to then activate. And so, for example, next week, we're anticipating that, we're seeing already a steadily increase in cases. So next week, we're going to be giving out test kits at local libraries to making sure that if people need a test kit and they want to be proactive, they can have a test kit to take home. There's, 2 tests per kit. And so we are grateful that we have the resources to provide that to the public in the partnership with the libraries so that people can be able to get access to testing. Our Board of Ed also for spring break made sure that children were sent home with rapid test kits so that they can get tested before returning back to school. And so we're doing a lot of proactive measures to making sure that people have access to testing, know their status, and making sure that they quarantine for at least 5 days to ensure that they do not expose other people.
I'll talk about masking because, again, I was referencing the friend that I spoke with this morning. He was unaware that young people need to be vaccinated for their safety as well as our safety. And as I say, he's a news hound. But talk about currently where we are with masking in light of the court decision this past week.
Well, so the court decision this past week was at the federal level for airplanes and making it mask optional, and that is a concern. We know that on the planes is recycled air and can pose a risk. And so what I want to urge the community is that if you have a medical condition and you're not vaccinated, you should wear a mask, especially in the airplanes. And, certain airlines are trying to see how they can bypass that. And so we have to see where that is. So the mask optional, of course, is a social responsibility of an individual. And so we are now in this new phase where the responsibility does fall on the individual to be able to ensure that they're protecting themselves and others. And so, I would encourage individuals to wear a mask. It is mask optional. And that decision, came out of Florida. And we know Florida was a major state that really were against vaccines, against certain treatments, and were very vocal about being against masks. And so, here in Connecticut and in the city of New Haven, we've made it also mask optional in social settings, because social settings, you don't have a requirement to go to the movies. You're not required to go to the restaurant. And so it is a social responsibility. However, children and employees are required to go to schools and into our
Yes.
municipal buildings. And so we decided in New Haven to maintain the mask mandate currently until further notice, and we'll continue to review and assess a number of variables before making any decisions on lifting those masks.
I want you to elaborate on what you've just said, even if you repeat exactly what you've just said, because I don't think that folks understand what's going on in terms of the state politics, federal politics, individual cities, and people. This is a mix. This is a delicate dance that is just can be very bewildering. So what you've just stated was so clear, but if you want to repeat it again or say it differently about how you as an official responsible and held accountable for our public health. Again, remember, folks, this is public health, and how you still have to interface with various issues, ideologies, political preferences, people running for president, et cetera?
You know, unfortunately, this pandemic was certainly politicized. That's what happened nationwide, especially during the Trump era. And a lot of misinformation, unfortunately, um, really was spearheading in around the social media and other factors. And combating that misinformation was a priority for us in Connecticut. And we were one of the leading states to be able to protect our community, especially here in the city of New Haven. In comparison to many urban cities, we did a really good job. I mean, we had like the gold standards before we of opening schools and making sure schools had their ventilation systems and things in place. And so as we transition into this evolving pandemic, when 2 years ago there were limited resources and accessibility to proper healthcare in responding to COVID, but 2 years later we have so many medical interventions, we have vaccines that are available. So we are transitioning and continue to evolve to a model where mask is optional in certain settings, like in social settings, and it is up to the individual to be socially responsible for their own health. Nevertheless, where I still have regulatory um, support right now and enforcement is within our public schools and within our public buildings. And made that decision because we want to make sure that our workforce feels protected and that we can remain open. And those are not optionals. When people are in the school systems, children have to go to school. Teachers and support staff and paraprofessionals are required to go to work. And so we want to make sure that they feel protected. And they were very vocal a few weeks ago at a Board of Ed meeting, in fact, urging me and the Board of Ed members to maintain the mask mandate. So I want to commend those individuals that came onto the meeting and gave their testimonies, because I knew at that juncture that we were making the right decisions. And I just want to make a note that we make accommodations, especially in the school systems. We have special accommodations for children that have difficulties with masks. And so the school administrators work very closely with those parents and caregivers. And so I encourage those parents to make sure that they continue to do that.
Indeed, indeed. Let me jump for a second to consumer awareness, public awareness, frustration with 2019 still being with us in so many ways. And so my question is, if I have a young person that's going to go to kindergarten or first grade in September, he or she is going to need a certain amount of vaccinations, correct?
Correct.
And you, in terms of your crystal ball, what's preventing the COVID vaccination to become mandatory as some other vaccinations have already passed legal scrutiny?
Yes, other vaccines have been out for many, many years, and definitely diseases have been eradicated because of those vaccines. And so those mandates certainly took legislation at the state level to be mandated. And in order for us to get this COVID-19 vaccine mandated, it has to be a legislative process. And that's something that will need to come from our constitutional officers. And so, of course, as a parent, I get it. When new vaccines, I remember when I was a young mom, I was a mom and my son was young, and the varicella vaccine, the chickenpox vaccine had just came out and was so new. And before I vaccinated my son, I needed to figure out the best way to ensure that that vaccine was going to be safe, because it was such a new vaccine. And as parents, we want to protect our children. And so I get it as a parent. There's a new vaccine out for children, and I understand and empathize. But it's important to really get the access of information. Speak to your pediatrician, especially because your pediatrician is your partner on the health and well-being of your child. And so questions that you may have, no question is a dumb question. And any concerns that you want to bring up to your provider, they can help assist with facilitating that. But as far as a mandate, that really is up to the legislators at the state level. And, in a conversation that does need to continue to happen.
When you mentioned the state level, it just dawns on me that you Or also, I mean, obviously you're focused on loving New Haven and keeping New Haven healthy, but you're part of some regional, state, and national organizations from a public health standpoint. What's the discussion, either statewide or nationally, on this topic about mandates or increasing vaccination rates?
Right now, there are no mandates for the children's vaccine or adult vaccines at this juncture. It is still an option, but there are restrictions in certain settings. So certain employers will not hire you if you're vaccinated or will require you to get tested a number of times a week in order to stay employed. And so, depending on where you are, it does vary. Certain states are very progressive and pro vaccines, and other states are not. And so it's really distorted, honestly, on the national
Mm,
level.
mm,
And at the statewide level, as you know, we are not mandating it either. And that was announced by the governor many months ago. And so what we do is ensure that we continue our efforts in promoting messaging, allowing the people to know how to access vaccines, and making sure that those resources are made available through our partners and through our trusted messengers and our media like this one.
mm. I'm going to come back to prevention as well, but I want to kind of ask one more kind of somber question, because you referenced the decrease in vaccine in boosters. A young person might get the first dose, and the smaller percentage will get the second dose. But the booster dose is even more dramatically underutilized, so to speak.
Mhm.
And also given the temporality that that the second dose can kind of wane.
Mhm.
Just repeat that again. That, I mean, for example, I get my flu shot every year, but we
Mhm.
might be possibly this regimen of an annual shot might be, something like you drink water every day. Well, that's an
Mhm.
exaggeration, but talk about the discontinuum as you look forward if we don't have higher participation rates.
We will see that individuals will not be fully protected, and not being fully protected poses a risk of getting COVID, depending on the variant that we are being faced with. Just a few months ago, we were being faced with Omicron BA.1, and now here we are 3 months later, and we are now being impacted by another strain. And we know that the virus is continuously changing its strains. It is nice to see that the uh, we are seeing the COVID-19 variants symptoms be lesser, and the severity of the disease be less, the burden of it on people. And we want to make sure that people remain protected and get vaccinated. I mean, we have enough studies that indicate that efficacy wanes. And so getting that booster is really critical, and also promoting it to children to making sure they stay protected because they're surrounded by others in the school setting or even when they're socializing outside of their home.
What do you, if I, just before I want to talk about some of the basic behaviors, but just to remind people about washing their hands, et cetera. But as a sidebar, what are you doing I always ask this, I don't always ask this question, but 75% of the time on my shows, I'll ask the question, what do you keep it doing to kind of keep yourself, healthy, well, and sober, and not jumping off a cliff? Are you exercising more, or different eating regimen, or cooking? What are some of the things that help you to give you a little bit of a diversion? Because again, it's high admiration for people that are public health directors nationwide. This
You're
is
talking about
never,
my self care?
well, to the extent of how you want to label it.
Yeah, no, I
Mm,
think I think self-care is so important. Our physical and mental well-being is so critical. I am often encouraging staff to take time off. I remember we didn't have vacation for, or time off for over a year. And I had to be the first person to take a couple of days off just to set the tone for the rest of our staff. And for me, eating healthy is so vital, and also exercising. I try to make sure that I work out and make sure that I am eating well because, different factors also impact our bodies. And as you know, in our community, we have a lot of people with chronic conditions, and that hasn't changed. And people are still dealing with their chronic conditions and then being then impacted by testing positive with COVID can impact one greater. And so for me, I need to set an example as a health director. I can't be talking about promoting health and not be healthy myself. And so I try my best to keep my physical and my mental health intact so that I can still be able to run this city and be able to be a public servant for the people of New Haven.
Talk to me about leadership not being a popularity contest. Again, something to those folks that are listening to this show and that will listen to this show. We don't want to discourage, but we're trying to encourage. And I'm really somewhat disappointed about the media industry. I mean, I'm part of the media industry, but we have not been able to persuade as many people as I would like to take proactive action, to take ownership of their own health. But where are you when you think about social media? Or I'm curious what your son might even say about encouraging his peers.
Yeah, no,
Mhm.
I'm going to say this. We're very fortunate here in my city, our city, because you're from New Haven also, that we have utilized what I like to call a social marketing model. And it's an evidence-based model where you utilize a different avenues to get the message out. And we've been very successful in doing that. So we have used a couple of things. We have done a combination of utilizing social media coupled with traditional media, and also utilizing trusted messengers, grassroots leaders to help spearhead the messaging. And what we did is create a communication committee. And as a leader, we have to know when we serve as a convener. We don't have to always lead from the top down. And throughout this pandemic, what I did is partner with all different stakeholders that all have a core value, which is to protect the well-being of our community. And we all had that core value. And being able to engage different people throughout this process and thinking through literacy and language barriers so that our information can be easily understood and within the preferred language, and considering the cultural nuances so that so people can have the autonomy to make the choices that's best for themselves and their families.
Mention some of your partners because it's important for people to know that Cornell Health is the New Haven Health System. I'm
Yeah.
assuming Clifford Beard, but just go
We
down the
had
list.
a number of so exactly. Our community health centers have been instrumental. Our hospital, Yale, New Haven Hospital Health System, Griffin Hospital, faith leaders, business owners, influencers that are small business owners. You name it, we have tapped into every single group, including our youth campaign. We have a youth video out now. It's like a Brady Bunch theme where our youth are part of that video. We also have utilized sports players in the high schools to do peer-to-peer education. So we've done a number of things, even cheerleaders in one of our press when we kicked off our youth vaccine, because we know that when we're doing peer-to-peer education, we can be able to do greater. I don't have to always be the messenger. The messenger can be other avenues so that we can still be promoting the same message, but really coming from different individuals so that we can be able to influence the change health behavior as a whole.
Indeed. And it's so important to hear you say that because I'm trying to urge people during this show to, yes, we're focused on COVID-19 and it's 2022, but there's a future, but this future will not be healthy as much as we want it to be unless we kind of deal with this issue, because there's going to be other issues, health issues that will arise that we can't necessarily predict. So cultivating, as you say, within I'm not sure whether it's Gen X or the Gen Y, whatever the young people are, whatever they call themselves, is cultivating their healthy consumer habits now to be proactive and preventative is so important for their future. Maritza, I did a show about 5 weeks ago with a father and his son, and then a mother and her daughter about COVID and vaccination for young people. And the daughter mentioned, who was 8 years old, I had posed the question to her, has this additional information about COVID and the need for boosters, et cetera, has it caused you to be more interested in education or interested in science? And she gave a very profound answer that partially she said yes, but partially she said no, because it scares me. He's maybe
Hmm.
9 years old. And so
Aw.
that dilemma about what the future might hold, unless we get a handle on this collectively, was really sobering for me, for a 9-year-old to say, yes, I'm inspired from an academic standpoint, but emotionally, it's scary.
Mhm. No, and those are the things that we work with our partners to be able to combat those messaging. And, that's our commercial has 3 young adolescents sort of promoting vaccines because they can, and other children can see that and be able to overcome that fear of unknown.
The, um, we have about 10 more minutes, so whatever might kind of be burning on your heart, mind, and soul, let's go through again the importance of just the basic 101 about washing hands. If you're sick, not going to work, it's kind of that,
Yeah, so, I think
mhm.
just continue to practice hand hygiene and respiratory etiquette, right? So we never realize how our aerosols project the closer to the distance of the individual, and really be able to know about mask wearing. We've done a lot and come a long way about educating people about the differences about mask use, and really encouraging people to really stay home if you're sick, getting yourself tested if you're presenting symptoms, because we want to make sure that we're not contributing to expanding cases within our community. And we want to make sure that individuals get fully vaccinated. Visit our website at covid19.newhavenct.gov. We provide a wealth of information. We promote all of our services, both testing availability as well as vaccines, and update them. So I want to thank you for the opportunity to be here with you, Tom. Once again, we've known each other for so many years, and it's just great to be back home in the city that inspired me to go into public service to begin with, and looking forward to staying connected and seeing you again one day soon.
Well, again, we have about 10 more minutes, so I'm not going to let you off the hooks just
Oh,
yet.
okay.
And it's good to see you as well. Uh, Testing, how frequently should a person, even if you feel that you're healthy, in general, and you've mentioned how convenient it is to do the testing. As a rule of thumb, what are you suggesting and recommending in terms of the frequency of testing, even if I feel
Yeah,
healthy?
testing should be if you have been presenting symptoms or have been exposed and need to get tested to get clearance to get back to work. And so it's important for people to quarantine, which means that you just isolate from others in your home. Isolate means you tested positive. You certainly need to be in an area that's separate from others so that you don't expose other people in your household. And we did a lot about distinguishing what isolate means and quarantine means. And the CDC did modify those rules for a 5-day rule. And so we encourage people to make sure that even if they think it's allergies, we have seen people presenting allergies and then they end up testing positive. And so it's critical for people to just get tested, and a testing site is available for where we are in the city of New Haven, right on our website. And if you visit the Connecticut Department of Public Health, depending on where you live, there's a statewide testing directory available also.
And so just when you mention allergies, that's so important. So should a person just routinely, say every 4 months, every 6 months, consider getting a test, even if he or she feels healthy?
I'm sorry, I didn't hear the last part.
No problem. Even if a person feels healthy, and particularly if you mentioned allergies, you can sometimes think you
Yes,
might have.
exactly. For certain. And we've been seeing that already being reported. So what we do is we do contact tracing, especially with dealing with outbreaks, and people's symptoms are mild in presenting similar to allergies. And so if you've been in a social gathering or someone has told you that they've tested positive, and just making sure that you get yourself tested within 3 to 5 days after that exposure.
And again, there's the testing is not egregious. It's not that it's an amputation.
I
And
know.
is a turnaround time quicker these days in terms of getting your results?
Right now, we are certainly in a good place. The demand of testing has significantly increased from what we were dealing with during the holiday season, and so we're all geared up. And as I mentioned earlier, we are providing rapid test kits starting Monday at the local libraries.
Right.
Our website should be updated with that information and gaining access to a test kit so that you can be able to have accessibility as well.
Good, good, good. I mean, I won't hold you. We do have a few more minutes, but again, I know that you're busy, and I want you to get out here. And because I'm thinking, just as talking to you, Maritza, about a year and a half ago, I can see you in my mind of knocking in Newholville on doors. Just talking
I
to
was.
people. Just
I
talk,
was.
talk about that. I think that's illustrative
Yeah.
of your
You know,
commitment.
for me, I'm not a health director that sits on her desk. You know, I'm a community person. I started my career 20 years ago as an outreach worker, and that has been embedded in my blood. And so I went right into the field when it was time to get people vaccinated and get them access to even testing. We were knocking on doors and talking to people. We were right at the front line, and we did that in partnership with many people that came out with educational materials, had great conversations, and were able to get people out to get vaccinated. And it's an effective tool. And you know, I actually had someone that said to me, and was almost in tears because when she saw me, she says, I've never seen a health director in the community. And I said to her, I was so humbled to hear her say that. But for me, it's my norm. I did that. I've done that throughout my career. I just feel like it's important to set an example for others and be part of the community. And that's why of course, I also live here in New Haven. And it's really vital for people to know that we're not just sitting behind the desk making decisions, but we're here for people right in the community. And so I do get out there. I love this city, and I have done that throughout my entire career in every other area that I have served.
Thinking, in addition to your Newhall, when I comes to mind the picture of you in Newhallville, I also just flashed in my mind you were down on the Longworth with your clipboard and talking to folks.
I sure was. Yes, we were. And then even grabbed lunch at the food trucks. So yes,
Okay.
supporting local business.
So
Yeah,
yeah, go ahead.
No, we actually activated in every single neighborhood throughout the city and partnered, with local community leaders to be able to be effective in that role. And we saw that it worked. We look at our vaccination rates as a whole, we're doing well. We just have to improve on our booster doses and our younger age children to get vaccinated. And so I employ our community to let's get out there and get vaccinated.
So let's give you the last word then in terms of the young people, because it's frustrating just even to kind of articulate this term that the young folks they're still vulnerable. They're at risk. These are our babies, or 5-8-year-old, 6-year-old, 7-year-old babies that it should be 100% protection that we want to extend that cloak of love around them,
Yes, sir.
and not just have them walk through a treacherous landscape. So I just want to give you the last word about just why we must not just throw our children aside. I mean, we're putting them at risk by they're not being protected.
You know what's so ironic is that parents are getting the vaccination and then not vaccinating their children. And we see scientific evidence of the long COVID and impact that this can have on our children. So just
Right.
like you are protecting yourself, you should protect your children because we don't want long-term impacts on children, internal organs, respiratory problems. And so it's important that parents protect themselves as they have done, but also protect your children.
Great. All right, we're going to conclude on that note, and that's just
Oh,
so.
wonderful.
Please, everybody, just listen to what Maritza is saying. She's not preaching. She's not giving a big speech. This is a free information she's sharing. She's not looking for contributions. She's just sharing why her role is so important as a person and putting her reputation online. Again, Maritza, these public health officials, you guys are putting your reputations are online. And
Always.
so I guess to respect your transparency and your
Thank
authenticity
you.
in this regard.
Absolutely. Government management is tough and you have to hold, different internally and externally people are accountable when people's health is jeopardized. So thank you for having me. I'm so
Thank you
grateful.
again. as always.
Got some ambition,
I love the song.
filling positions, looking at the void in myself.
This is Harry Grove, and you're listening to WNHHLP 103.5 FM New Haven.
And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, lights, camera, action, I'm ready to go. I'm never gonna give up, fall down, I just gotta get up, yeah. Yeah, this is my road, lights, camera, action, I'm ready to go. Way too long, we faced them storms, now you gon' face the dawn you waited for. I said from night to dawn, I right my wrongs alone. In competition with warnings, ice galore. Now I'm running toward it, my lights unfinished, being a quitter. But little by little, they joking, telling some riddles. Now I'm in my section, ain't willing to give up. Know you getting knocked down, but you gotta get up. I'm never gonna give up, fall down, I just gotta get up, yeah. Cause this is my road, lights, camera, action, I'm ready to go. I'm never gonna give up, fall down, I just gotta get up, yeah. Yeah, this is my road, lights, camera, action, I'm ready to go.